behalf of Zero Vision, I, Gautami Chatterjee, want to discuss some few points about COVID-19 after effect. Some people continuously experience health problems long after having COVID-19. Understand the problem, symptom and risk factor for post-COVID-19 symptom. Let's go through some few facts about COVID-19 after effect by Alisha Malli.
Yes, COVID-19 has gone, or may not. But the persons who are the survivors of COVID-19, after fighting with the deadliest part of their life, the COVID-19 didn't leave them fully. Still, it leaves some of its trace, which becoming a way to kill somebody every day, little by little. Yes, you hear the truth. Most people who get coronavirus disease in 2019 recover within a few weeks. But some people, even those who had mild version of the disease, might have symptoms that last a long time afterward. These ongoing health problems are sometimes called post-COVID-19 syndrome. Post-COVID conditions, long COVID-19, long haul COVID-19, and post-acute sequelae of SARS-CoV-2 infection, PASC.
What is post-COVID-19 syndrome and how common is it?
Post-COVID-19 syndrome involves a variety of new, returning, or ongoing symptoms that people experience more than 4 weeks after getting COVID-19. In some people, post-COVID-19 syndrome lasts months or years or causes disability. Research suggests that between 1 month and 1 year after having COVID-19, 1 in 5 people ages 18 to 64 has at least one medical condition that may be might due to the COVID-19. Among people aged 65 and older, 1 in 4 has at least one medical condition that might be due to COVID-19.
What are the symptoms of post-COVID-19 syndrome?
Now we are talking about the symptoms of post-COVID-19 syndrome. The most commonly reported symptoms of post-COVID-19 syndrome includes fatigue, symptoms that get worse after physical or mental effort, fever, lung symptoms including difficulty breathing or shortness of breath and cough. Other possible symptoms include neurological symptoms or mental health conditions, including difficulty thinking or concentrating, headache, sleep problems, dizziness when you stand, pins and needles feelings, loss of smell or taste, and depression or anxiety. Joint or muscle pain, heart symptoms or condition including chest pain and fast or pounding heartbeat. Digestive symptoms including diarrhea and stomach pain. Blood clots and blood vessels issues, including a blood clot that travels to the lungs from deep veins in the legs and blocks blood flow to the lungs. Other symptoms such as rash and changes in the menstrual cycle. Keep in mind that it can be hard to tell if you are having symptoms due to COVID-19 or another cause, such as pre-existing medical condition. It's also not clear if post-COVID-19 syndrome is new and unique to COVID-19. Some symptoms are similar to those caused by chronic fatigue syndrome, and other caused by chronic fatigue syndrome, and other chronic illness that developed after infections. Chronic fatigue syndrome involves extreme fatigue that worsens with physical or mental activity but doesn't improve with rest.
Why does COVID-19 causes ongoing health problem?
COVID-19 caused ongoing health problems. Organ damage could play a role. People who had severe illness with COVID-19 might experience organ damage affecting the heart, kidney, skin, and brain. Inflation and problems with the immune system can also happen. It isn't clear how long this effect might last. The effect also could lead to the development of new conditions, such as diabetes or heart or nervous system condition. The persons who have experience of having severe COVID-19 might be another factor. People with severe symptoms of COVID-19 often need to be treated in a hospital intensive care unit. This can result in extreme weakness and post-traumatic stress disorder, a mental health condition triggered by a terrifying event.
What are the risk factors for post-COVID-19 syndrome?
Yes, the risk factor for COVID-19 syndromes are: you had severe illness with COVID-19, especially if you were hospitalized or needed intensive care. You had certain medical conditions before getting the COVID-19 virus. You had a condition affecting your organs and tissues, multisystem inflammatory syndrome, while sick with COVID-19 or afterward. The post-COVID-19 syndrome also appears to be more common in adults than in children and teens. However, anyone who gets COVID-19 can have long-term effects, including people with no symptoms or mild illness with COVID-19.
What should you do if you have post-COVID-19 syndrome symptoms?
Yes, the things we should do when we have post-COVID-19 syndrome symptoms, they are: when your symptoms started, or what makes your symptoms worse, or how often you experience symptoms, or how your symptoms affect your activities. You should take an appointment to your healthcare provider and prepare this chart. Your healthcare provider might do lab tests such as the complete blood count or liver function test. You might have other tests or procedures such as chest x-rays based on your symptoms. The information you provide and any test result will help your healthcare provider come up with a treatment plan. In addition, you might benefit from connecting with others in a support group and sharing resources. These are the things which are affecting our conditions after COVID-19 leave us, and the things we should do if we got any syndrome about the post-COVID-19.
Be careful and safe from post-COVID-19 syndrome. Zero Vision means unbiased news. Need your support and comment. If you like it, please share to your friends and family. Today, that much. Thank you very much. Namaskar.